Idaho Matters podcast is brought to you by St. Luke's On Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on demand care for common ailments such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org. Idaho lost more than 2,000 farms over a 5-year period. Idaho Matters wants to know how that's impacting farmers, cities, and counties. Listen to our series on farming called Land and Legacy. Episodes available on Monday afternoons through November 17th in the Idaho Matters podcast feed. From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Idaho's Medical Freedom Act, which took effect on July 1st, has public health experts concerned. This new law makes it illegal here in Idaho for schools, employers, even local governments to require vaccines or other medical interventions. Now, supporters of the law say this is a win for personal choice and medical freedom. Critics say it could open the door to the return of diseases that were once wiped out here in the U.S. And now the folks behind this new law want to use this as a model for other states across the country. It's Wednesday, which means it's time for our Doctor Roundtable with Dr. David Pate, the former CEO of St. Luke's Health System and the co-author of the book Preparing for the Next Global Outbreak. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. Dr. Pate, from your perspective, what does this new Medical Freedom Act actually change in practical terms for folks here in Idaho?
Well, that's a really good question because it raises many questions in my mind. I understand, I get it, that people were upset about a lot of things having to do with COVID and how the pandemic was managed. I got that. The
Mhm.
problem is that this is going way beyond that. And as I read the bill, and there's been really incredible reporting by Audrey Dutton, so I want to recognize her. But as I look at it, really, for example, you and I have talked about some cases where there were kids in school that turned out to have tuberculosis. The way that I read this bill, you could not force that child to remain out of school until on treatment and no longer contagious because although the word's not defined, I don't believe that one child would constitute an outbreak of a disease. So there's a lot of things here that would be really problematic. I think daycares are going to be a lot more risky. Really, who is going to be really significantly impacted by this bill are pregnant moms and children and adults that have immunocompromised states.
So, Dr. Pate, in Audrey's reporting for ProPublica, and folks, if you want to read her article, you should look it up. It's very in depth. She pointed to a situation in South Carolina, a quite conservative state, just recently, where they quarantined in 2 schools more than 150 unvaccinated children once measles was detected in that community. Now, um, during that quarantine, 5 students started to show symptoms because it can take, as we've talked about, upwards of 4 days. You can spread the symptoms for 4 days, even if you don't have symptoms. So, health officials in South Carolina said, they really believed that by doing that, they controlled the spread of measles. Idaho already has some of the most relaxed vaccine requirements in the country. So, looking at what happened in South Carolina, as you read the law, I think as a lot of people read the law, schools could not do something like that South Carolina did if, in fact, we have a case of measles in the community in a school. So, how significant is this law in real world terms here in Idaho?
Well, I think it's a huge issue, and I read the law the same way. I applauded the governor when he first vetoed this bill because he said schools have to have the ability to send sick children home. Totally agree. The way they got around it was okay. You can do that for a sick child, but you cannot do it for a well child, which means that you wouldn't be able to take those quarantine steps that you were just referencing. And if we were to have an outbreak, and I'm sure the day's coming that we will,
Hmm.
then that means we couldn't quarantine at risk students. Measles, in this particular example, is the most contagious virus that we have. And it just means that it will continue to spread through the school and through those children and then to their homes um, if we can't quarantine. And especially if these are parents of children that are not going to get their children vaccinated in the face of a outbreak. So our hands are going to be tied. It's going to pose a lot of risk to a lot of other people. People are celebrating their quote unquote freedom, but it's at the expense of others. And so I think the other thing that look, this is why we have legislators is to determine what our laws should be. But what I think is very bad about this bill, as well as many others that have recently been undertaken, is legislators have been provided demonstrably false information. And because they have not made an effort to get the correct information from experts, they are making some bad decisions that will score them political points, no doubt. But there's a lot of misinformation that was used to come up with this policy. And we're going to find out the problems when we get to other diseases besides COVID that everybody is so tired of dealing with. And we will face these other diseases.
So when we look at the possibility, let's say, of a measles outbreak, right, because of how contagious it is, what are the potential public health consequences when it comes to not being able to require, let alone a vaccine, but let alone any other medical interventions like quarantine, right? So
Right.
even if this were to happen in a school, let's say, kids go home, kids are out in public. What could this look like when we have a law like this in place?
Well, in fact, we don't really have to imagine very hard because we can look at current examples that are happening. Jimmy, you and I have spent a lot of time talking about the West Texas outbreak
Hmm.
and what happened with measles there. Texas had 762 cases that we know about. There were no doubt others, and two children died. Um, and what we know is that measles is the most contagious virus we deal with. It can linger in the room in the air for an hour before someone comes in the room or after. And we're going to have transmission in schools where children are not vaccinated or they're immunocompromised. And as you pointed out, they're going to take measles home. And what we saw in the West Texas outbreak, as well as other outbreaks that have been happening since then, is that it does spread to even adults. In fact, in New Mexico, where it spread to, we had an adult die of measles. And because the protection is really, really good, but it's not perfect. And what we see with measles is about 20% of those that get infected will have to be hospitalized. And we will see for every 1,000 cases, 1 to 3 children die. We've also talked about on this show the fact that getting measles impacts these children's immune systems, and they lose temporarily for a matter of perhaps a few years some of the protection they already built up to previous things. And what we see is increased risk of mortality from other infections in those few years after measles. And then, of course, finally, you and I have talked about a very rare complication, but one that we just had a case of in California, if I recall correctly, where
Hmm.
years later, this can come back to cause an overwhelming brain inflammation that is not treatable, and those children uniformly die.
So one of the things that stood out to me about the advocates of this new bill was one of the individuals who has stood steadfastly behind this bill, wanting it passed, got it passed, has made the argument about medical freedom in regards to it is not an individual's responsibility to be forced to take a medical intervention to, quote, protect other people. How do you respond as a medical doctor to that argument? On a personal note, it quite surprised me that there is a lack of understanding, I guess, or empathy of trying to do what you can to keep your community healthy.
Yeah, I don't know. I can't read people's minds or see into their hearts, but
Mhm.
it really is hard for me to believe, particularly the person you're referring to, that this is just a matter of just pure ideology or just not understanding. My guess is that if you go to work and you find out somebody is in the office with active tuberculosis, I can't imagine we're going to see too many hands raised that think, oh, that person should stay in the office all day. Let me have meetings with them. Let me hang out with them. People are going to want that person home until they are no longer infectious. I think that most people in their personal lives, if you had just been to the doctor and they tell you you have a bad case of flu, and you're planning to perhaps go see grandma and grandpa this weekend, I think most responsible people are saying, I don't want to take that chance. I'm not going to go see them. And so I think in their personal lives, this is not how they behave. And in fact, how far do you carry this argument that you should have freedom because you should not be infringed on to prevent doing something you want to do, just because it might help somebody else? Well, does that mean we get rid of our drinking laws if you're going to operating a car? Do we get rid of our seatbelt laws? Do we get rid of the traffic laws? Because you ought to just be able to do whatever you darn well please. And it's not your job to ensure other people are safe. I was driving my car the other day, and a little child ran out in the street in front of me to get a ball. I'm very glad I was driving slowly and I was attentive. I wasn't on my phone. I was watching, and I stopped in plenty of time for that child. Do we really believe that none of us have a responsibility to those children or to others? It's hard to believe we have become that cold in our hearts. Although I will tell you, I tend to be a very naive person, and I'm always a cup half full person. So maybe I'm thinking better of people than they deserve.
Dr. Pate, my husband tells me the same thing about myself. So I don't think that's a bad way to be. With that said, then, how how do we, especially in Idaho, right, where, as I mentioned, we have lax vaccine regulations even before this law was in effect, right? If you didn't want to vaccinate your child, you didn't have to. You could find an exemption. If you don't want to get vaccinated yourself, you don't have to, right? And frankly, I don't think most people take issue with that. So how do you then balance this individual, medical freedom with the idea of maybe collective responsibility to try to prevent the spread of disease? Or can you do that?
Well, I think it can be done. It's very, very difficult because we have to, first of all, as I've said, that the people promoting these anti science, anti public health measures and so forth, they are logically inconsistent. And I think one step is for because generally this is being done in the political process, we need journalists, we need other candidates in debates, we need others to challenge and say, well, wait, how far does this freedom go? Are you saying that our society is not better because of the fact that we have nuisance laws and my neighbors cannot be having a rock concert at 3 a.m. on their back porch next to my house? Um, are we really willing to give up all of the rules that we all function by so that we promote the well being of everybody in general? Are we really ready to let that go? And what steps are we taking? If you say, okay, if you're one of these that say, yeah, you just shouldn't have vaccines, all this stuff, making up nonsense, well, okay, then what else are we going to do? Would you at least advocate for improving ventilation and filtration and treatment of air in schools and public buildings? Can we do other things to help manage? And what you find is pretty soon either their logical inconsistencies or their insincerity become manifest. The other thing is, I certainly mention to those that also tend to be promoting this as some kind of biblical basis for this, how inconsistent this is with really what the teachings of the Bible are. But I think that for the mainstream, it's got to be, we have got to push this logic. We have got to ask tougher questions, and we have got to expose that their thinking on these issues is flawed, especially when the legislature, when you're considering this bill, when a person tells you that we should have this bill because measles is good for your body, maybe you should ask somebody that actually knows about measles. If you say that, that getting measles can cure cancer, maybe you ought to ask somebody who actually knows about cancer before you just say, oh, okay, let's just enact these laws.
Well, what's your biggest concern if more states adopt similar legislation? Because as I said, since this was able to get through the legislature, get passed, signed into law, advocates of this are hoping to use it as a model to go into other states and create these similar laws in other states.
Well, I can actually tell you what's going to happen. This is not a mystery because for those of us that have studied medicine and also know a little history, and it helps to be my age, we know what happens when you have these infectious diseases and you have a lot of children in school and who are not protected. And so we can tell you about the outbreaks. We're seeing them now. This is only just beginning. And what are we seeing? Outbreaks of measles. And so that's now. But we're going to see pertussis. I really have a fear we're going to see a resurgence of rubella. If this gets, won't be soon, but it'll take longer for that. And we're going to see other vaccine preventable diseases. I'm very concerned we're going to start seeing a Haemophilus influenza B infection in kids. When I was in practice, it was not that long ago, when I was in practice, every day we were having multiple children admitted to the hospital extremely ill with HIB, that's Haemophilus influenza B infections, meningitis, encephalitis, sepsis, things like that. Children at death's door every day. Today, most pediatricians and pediatric hospitals tell you they haven't seen a case in ages because we have an effective vaccine. People are going to stop taking the vaccines. You and I have already talked about how this is getting even carried away beyond vaccines, where we've seen parents refusing vitamin shots for newborns. And we're
Mm.
seeing the consequence. We're seeing newborn babies with hemorrhages bleeding into their brains and them dying. What's going to happen is these are going to return. You got Florida eliminating all vaccine requirements for school. It's going to happen. I can't tell you when it's going to happen because it depends on how many people fall for all this nonsense. But the numbers suggest it's going to be moving in that direction. And then we will see outbreak after outbreak after outbreak. And then what we'll find is that, in fact, it gets to the point where right now, when you and I ask people, they haven't seen a case of measles, they haven't seen a case of German
Mhm.
measles, they haven't seen diphtheria. We're going to start getting to the point where, yeah, people, oh, I know the kid down the street died from this. And I think once it gets to a certain level, then people are going to push back and say, oh, we've been lied to by all these anti-public health people, and now we need to hold them to account. It will have a lot of children die before then, but eventually that's where it'll go.
Canada is set to lose its measles elimination status, and the United States could as well. My understanding is basically that come Monday, Canada will have a continuing case of a measles outbreak, and so that impacts your status. So, if you could explain that better than I just did, but also if Canada and potentially the U.S. lose their measles elimination status, what does that actually mean for public health?
Yeah, this is something that most of us couldn't possibly have imagined that we wouldn't actually learn from history and learn from science. But you're quite right. I think probably Canada will lose their elimination status this year. I suspect we'll lose it next year. What a First of all, for something that we worked so hard to achieve, because we knew the toll that measles took on children, to just basically allow this to happen is just hugely defeating and demoralizing to those of us that care about children's health, care about public health. So there's that. The other thing is, Gemma, you will remember times, particularly in answering some of the listeners' questions about international travel, where I have warned some of your listeners about travel advisories to other countries
Mhm.
and some of the vaccines they might need. Imagine this: the North America, Canada, United States, and Mexico may soon be at the point where those in Europe and Asia that are considering coming to visit our countries as tourists are going to be looking at travel advisories because of all the diseases that we have that they don't have in their own country. So it's a terrible shame. It's really senseless. I understand there's some political point to be gained from all of this, but yeah, we're going to pay a very high price.
Mhm. So, Dr. Pate, experts are pointing to things like misinformation, disinformation, even social media as key drivers when it comes to vaccine hesitancy. So, is there an effective way to rebuild public trust, not just in vaccines, but I think in just public health in general?
Yeah, I do think that it's going to happen. It may take something bad for that to happen. So, for example, you and I have talked about the fact that with the dismantling of the CDC, with the dismantling of the White House pandemic coordinator, we are very vulnerable. And, there are still 3 more years to President Trump's term. If you asked me, is do I think there is a not insignificant chance that there could be a new pandemic threat to the United States in that period of time? I can just look back to history and tell you, yeah, there's actually a reasonable chance that could happen. And what's going to happen is we're going to be totally unprepared. And it's going to be worse than last time. And listeners might just think back to March of 2020 and the stories coming out of New York City. If you think I'm over dramatizing, look back at that. morgue trucks parked out in
Mhm.
the parking lot, nurses in plastic trash bags for their PPE. We are not prepared, and we're taking a while all this time that we're passing these kind of nonsense laws that make everybody feel better and score political points. We are getting further and further away from being prepared, and we need the legislature to spend at least as much time talking about, well, wait, what do we need to do for the next threat, and how would we respond to that? We're not going to be prepared. When that happens, I can tell you the people that have hung on to every word of President Trump's, of RFK Jr.'s, of the various misinformation people, they're going to turn on them big time because it's their responsibility to protect us. So that day is coming. I just don't know when.
So, with that said, are there steps that governments and healthcare systems can take right now to try to contain any outbreak? I mean, in particular, right, measles, and doing something so that it doesn't become endemic once again here in North America. I mean, maybe we could start with the fact that you and Dr. Ted Epperly actually wrote a book about preparing for the next global outbreak. So, I mean, I realize you've written a whole book about this, Dr. Pate.
Yeah. And it's apparently not getting read. But, to answer your question, we're taking away all of the tools in our toolbox. So if you can't send sick kids home, if you can't quarantine, if you can't insist on vaccinations, and if you can't even insist that we're going to put out truthful information to parents, it doesn't leave us with very much. And that's just measles. There's many other conditions, and we're just not going to be well prepared. My basic approach in terms of answering your question, when I try to make the very, very small gains that I sometimes make it with people, is that I think that we should not be judgmental. Like I said,
Mhm.
I am not upset with parents that make these kinds of decisions. I think they're doing the best they can. What I'm upset with is doctors and public leaders that know better, that are being dishonest, and people that aren't in acting in good faith. And I think what we have to do is we have to speak up to them, but we have to show compassion for those people that are being misled. And I shared the story with you that one day a lady was walking by my house as I was out unloading my car. She asked me if I was Dr. Pate. I said yes. She told me she was an anti-vaxxer, but she said she was raised in an anti-vax home. She never got her vaccinations. None of her kids had, but she'd been listening to your program since the beginning of the pandemic. And what she appreciated is I didn't judge her, and I didn't speak down to her, and I said
Mhm.
the truth. And she said now she's completely caught up with her vaccinations and all her kids. We're going to make very small efforts, but we have to be sticking to the truth, showing why the people that are putting out the disinformation are wrong, and have compassion in our hearts for these people who really are victims of disinformation.
Well, Dr. Pate, as always, we so appreciate you. We've been talking with Dr. David Pate, the former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak. Remember, if you have a public health question for Dr. Pate, send us an email, idahomatters@boisestate.edu. You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudet.
The stories don't stop when this podcast does. Boise State Public Radio's Instagram gives you reels, updates, and snapshots from our reporters in the field. Follow Boise State Public Radio on Instagram today.